Hi guys, I'm Haney.
I'm Karen. We're both nursing students, and as you probably guessed, we're going to be discussing fertility preservation. And we hope you guys all have time to answer your questionnaires, and I hope they're not so difficult. We'll go over all the answers in the end and make sure that every topic was understood and have time to answer any questions you guys might have. So during the presentation, feel free to write them down, and we'll have a few minutes to go over them at the end of the presentation. Okay.
So, as Karen briefly mentioned, we are going to talk about fertility preservation. So, first off, what is fertility preservation? It's the process of saving or protecting eggs, sperm, or any reproductive tissue so that a person can use them to have biological children in the future. So, why is this all important? Well, during our research, we actually found that about 150,000 patients in their reproductive years are diagnosed with cancer. And the reason why that's so important is because those patients who are in the prime reproductive years will be diagnosed with their cancer and then undergo their cancer treatment. So whether it's chemotherapy or just anything, whether it's medications, and what happens is that affects their fertility in the future and they actually become infertile. So when patients in the future try to have children after completing their chemotherapy or whatever medication they're on, they realize that they're infertile and they don't have the option of having biological children. So we're just going to briefly talk about how to bring up the conversation of fertility preservation with a patient who was newly diagnosed with cancer, just some resources, what they can do, and how, as nurses, we can talk to the patients.
And I just want to add to that, the reason why it's so important is we would hate a patient to show up to our office and say, I want to have children, I want to have a child, and after completing their cancer treatment and being told there's no eggs available or there's no sperm available, and they're unaware of the situation. Nobody ever explained to them that this was going to happen. So we, as nurses, it's our responsibility to educate them, give them the resources that they need, as Haney mentioned, so that they make the right, or what they feel is the right decision or an informed decision, so that there's no regret in the future. And you did your job or fulfilled your duties as a nurse by educating the patients and just sharing their options that they have available, so they don't go back and say, no one ever told me about this.
Which is such a huge part. So moving on, we are just going to briefly talk over our nursing diagnosis. So our nursing diagnosis that we came up with: deficient knowledge related to unfamiliarity with information resources as evidenced by significant gaps in current practice or lack of counseling. And that's from Ackley and Ladwig. So our plan regarding this nursing diagnosis is to educate the physicians, the nurses, just the people who are in charge of talking to the patients, to bring up the discussion of fertility preservation. We're basically going to show you how to talk to them, how to use therapeutic communication, and
And just to add to it, just Haney said, the way we came up with that nursing diagnosis was in 2013, the American Society of Clinical Oncology did research and found that a lot of cancer nurses or oncology nurses were not educating their patients properly regarding their preservation options, because they felt it was out of their role, or it was something that they didn't fully understand or felt comfortable discussing with their patients. So in the end, the patients were the ones that were misinformed or did not get all the details necessary to make an informed decision. So that's why we feel like it's important to discuss, especially knowing as a nursing school that there's no real class about fertility preservation or anything like that. So it is something that does require extra training, extra knowledge, and just we encourage all the nurses to just read about it, especially if you're an oncology nurse, just to feel comfortable to discuss it with your patients.
So moving forward, the health promotion model that we focused on when just looking at this issue of fertility preservation was the Nola Pender's health promotion model. So this model actually focuses on three main areas, which cover individual characteristics and experiences, behavior, specific knowledge and effect, and behavioral outcomes. So this is more so focusing on the patients rather than us teaching you guys how to talk to the patients. So this model will focus on integrating health promoting actions that result in desired behavioral outcomes. So when looking at this model, we can start by addressing the lifestyle and the characteristics of that patient. Everyone lives a different lifestyle, everyone has different characteristics, so you want to make sure you don't just use a generic way that is used on all patients. You want to make sure it's specific for each individual patient. Then we can move on to assess the individual's knowledge and effect, such as perceived benefits of action, perceived self-efficacy, interpersonal influences such as family, peers, norms, and situational influences. And then we will integrate this model into our practice as nurses by assessing a specific population who are diagnosed with cancer, who seek to have children in the future. So you want to just look at studies and make sure you know the area that you are teaching in, the population and the social determinants and all that. So the desired outcome of our teaching plan for you guys is to, as nurses, to have patients that are diagnosed with cancer to commit to an action that promotes their health. So we basically want to educate our patients so that they are well knowledgeable about fertility preservation and the options they have and the resources that they have. So our goal is to expand the knowledge and promote the act of fertility preservation with patients. Some behavioral changes we are hoping to see in the population as nurses is just patients who seek information. That's always good. You want to see that patients are proactive and they have that desire for knowledge. And just using the resources that we give them and having consultations with any physicians, any fertility specialists, stuff like that. So I did give you guys, I handed out the copy of the model if you guys want to look at it later. It's also in the PowerPoint if you look up ahead. Okay, so we're going to move on to the motivational interviewing method. In my personal opinion, this is one of the most important parts of a nurse educating the patient. If you put yourself in their shoes, you know, they just have been diagnosed with cancer and it's just life altering and it's just very devastating and it's a sense of loss and a sense of suffering, and you want to make sure that you're not just like, well, you were diagnosed with cancer, but did you know that you can save your eggs or you can freeze your sperm? You know, you want to be very you want to use a therapeutic method, and you want to make sure that the patients are, first of all, open to even listening about, you know, the options that they have. So one of the first things that you have to do as a nurse, a physician, a social worker, whatever your job may be, the most important thing is to ask for the patient's permission first. So you want to start off by saying, you know, you want to say something like, you know, I'm sorry that you're going through this, or I know this is a very difficult time for you. I do have some things I want to cover with you. How do you feel about, you know, talking about this? Or what do you think about fertility preservation? Or what do you think about starting a family in the future? What are your, you know, goals as as someone who might, I don't know, want to build a family in the future? Yeah. So you just want to make sure you start by talking or start by asking for their permission. So I did put up on the PowerPoint, if you guys can see, I put the, this is the Darn Cat, what is the word, acronym, I guess? Mm-hmm. So first you want to start by asking permission. So you would say something like, would you feel comfortable talking about infertility that can occur with your possible cancer treatment? So just as any doctor would, or nurse would, you want to tell the side effects of the treatment that they are getting, whether it's medication or chemotherapy or radiation therapy. You want to make sure that you educate them on all the possible things. So you say, maybe they want to seek treatment. You say, I see you're taking the path of, I don't know, cancer treatment. Is this is a possibility? Would you feel open to talking about this? So they'll say something like, yeah, I'm open to hearing about it, or yeah, can you tell me more about it? Maybe they'll say no, then there's that. But you can always give them the resources still. So after you ask for their permission, you want to kind of assess their desire. So you can say something like, oh, how do you feel about possibly starting a family in the future, or having children, or having biological children, I guess. And they'll say something like, oh yeah, like I want to have kids in the future, or I want a family in the future. Maybe not now, but in the future I do. So you want to then move on to their ability. And that is kind of, you start by asking, oh, well, how do you plan on starting a family, knowing that you're going to be undergoing this chemotherapy, this treatment? And they can say, like, that's when you can assess their knowledge too. You can see if they know about, egg freezing, sperm freezing, the tissue freezing. So, excuse me. Then you want to talk about their reasons. They're evoking or eliciting change talk. So you want to know what their reasoning is. So you can say something like, oh, well, what is your reasoning behind the change that you wish to make? And there's always different options to kind of mold the conversation to fit the kind of individual that they are, depending on their characteristics and just their personality. Your patients, you talk to them, so you want to ask them that, and they'll say something like, well, I know that, I need to know that I can have kids after I finish this treatment. Something along that line. Then you move on to, well, what makes you feel the need to do this? And they'll say like, well, I need to know that I have options after I have chemotherapy. I don't want to be going through this treatment knowing that I'm not going to have that option in the future. So even if they decide not to have kids, they still have the option to. Then you want to talk about their commitment. Fertility preservation is not just like, oh, I'm going to do it all in one night. It's a process. It takes an emotional toll, it takes a physical toll, and you want to make sure that you communicate that with your patient, and you want to make sure, is this something that you're willing to commit to? So you want to tell them, I might not have, as a nurse, I might not have all the resources and all the knowledge that I can give to my patient about fertility preservation. So that's when you would take the resources that you do have and just give it to them and say, well, these are some options that you have. These are some resources. These are some fertility specialists you can go talk to, and how kind of like navigate them, Then you just want to see, are they ready to take the necessary steps? Well, you can also ask them, well, what have you done already? So maybe they already know about the whole issue of infertility with cancer treatment, so you can ask them, well, again, it's kind of like assessing their knowledge. You can ask them about that, about what they have already done. So now they can say, after having this conversation, they can say, well, I had this education that you gave me just now, Or you can give them some pamphlets, some brochures, some websites. There's a lot of internet links that you can always show them to. And then you want to always end that portion with an open-ended question. So you can say, well, instead of saying, do you have any questions, and it being yes or no, you want to say, what are some questions or concerns that you have? And then they can say something like, well, I'm not sure how, it's all going to work out in the future, or how my chemo treatment is going to go, or how this cancer is going to go. So you want to make sure you give the option for the patient to express themselves. Then you just want to thank them for their time. You want to make sure you affirm everything that you've just kind of talked to the patient with, and then kind of reflect, which is kind of like summarizing the whole conversation that you had. And then you want to, you can always use a scale to see where they're kind of at on the whole issue. So, you can say, like, on a scale of 1 to 10, how do you feel about seeking treatment like fertility preservation after our conversation. So those are just some motivational interviewing methods you can use. And again, it's on the PowerPoint if you guys need it later. I can always send that to you as well.
And just to add to what Haney said, sometimes you're going to get patients that are going to say, at this moment, that's not my concern. I want to live. I want cancer treatment. I want to focus on my cancer treatment. But you want to make sure that you gave them all the knowledge that they need to make an informed decision, all the resources they need. If you feel like maybe they're just not thinking about it or really reasoning with you on the topic, and maybe they're just really depressed that they don't feel like this is the right time to make such a big decision, you can always refer them to counseling, or there's psychologists that focus just on fertility preservation so they can discuss it further. Again, they don't have a lot of time, so it's either you do it now or they don't ever do it kind of thing. So you just want to make sure that you give them all the information, like you said, all the resources that you have available. And basically they can't ever turn back and say, I was not informed, I wasn't given the right information to make an informed decision, because like we said, it's a once in a lifetime decision. Like they can't go back after the cancer treatment and say, I regret it, let me go ahead and do fertility preservation. It has to be done then. Treatment is started within days, so they have a very short period of time that they have to make a decision by. So you just want to make sure you inform them as much as possible and refer them to counseling if necessary. There's also fertility doctors that give free consultations if they feel like they need just to discuss it with a specialist that can provide many more details than we can possibly provide. So you can always refer them to that. I always recommend for oncology nurses to go to conferences. There's a start hour every year where you can go and you can gain units, and in addition to that you can go ahead and link up with fertility specialists, fertility nurses, gain a little bit more knowledge, get business cards. That way you know different places to refer your patients to. And always someone, if you have a question the specific question that you don't have the answer to and want to help your patient, at least you have that phone number to call, or that friend, or that email to ask another nurse or about that, or to refer them to.
Okay, so moving on, we're going to be talking about barriers. So something, as a nurse, you always want to be considerate of the possible barriers that the patient might be facing. So whether you're working in a hospital or you're working at a clinic or you're a public health nurse, you always want to assess the patient's potential barriers. So with fertility preservation, you want to assess their culture. There's some cultures out there who think fertility preservation is sort of like a taboo, or they just want to stay away from it, and they think it's maybe it's unnatural. So you want to assess the patient's culture, and if they are someone who feel that way, you can always educate them. You don't necessarily have to be like, no, you're wrong, that's not how it is. You always need to respect their culture, and you just need to educate them. Just let them know, well, this is what it is. It's completely in the ball's in your court. You decide what you want to do, but let me at least educate you and show you what you can do if you change your mind. There's also the barrier of language, which is quite common living in California. There's a lot of different cultures and a lot of different languages that are spoken. So if that is the case, maybe you have a nurse who is fluent, and maybe you can have them educate the patient instead, or even use you can have the translator on the phone to help you educate the patient and make sure that they're understanding everything that you're telling them. Another barrier could be just like a lack of resources. Do they have, maybe there's not enough clinics, or there's always provider shortages around. Maybe there's not enough clinics that they are able to have access to that is nearby, which also leads us to the issue of transportation. So it's a little different depending on where you live, but for example, if you live up in the high desert area, transportation could always be an issue. There are buses and there are, trains, but it's not always the quickest way to get to the place that you want to. It can take hours to get to your doctor's appointment. So that can always be an issue, or even living down the hill, you can always have that issue as well. And one of the probably biggest barrier might be finances. But you just want to, again, you want to talk to your patient about where they're at, and if this is something that they are concerned with, then you want to make sure that you are providing them with resources. So as nurses, it's really important to make sure you gather all the resources that you possibly can, so that if this is an issue for one of the patients, you have that to give them, like Karen was mentioning before. And lastly, you also want to make sure that they are knowledgeable, and knowledge can be a barrier. If they don't know about it, they're not going to do it. So you want to make sure you educate them, and you want to make sure that they are just well educated, I guess, to make the decision on their own.
And just going back to the barriers they may face, so some solutions, I'm gonna focus more on the solutions that what can you do as a nurse to those barriers that the patients may be facing. So culture, again, and there's really no solution to that, but just being respectful, like Haney said. Language barriers, again, it's about linking with the different fertility centers. That way where there's nurses that can possibly speak Spanish. If you have a Spanish speaking patient, that might feel a little bit more comfortable with them, and we'll open up to them. A lot of doctors, we've contacted a couple offices, they have Spanish speaking nurses. They have translators available in case that the patient speaks another language. And lack of resources, there isn't a lot of resources as nurses we can provide, but again, like Haney said, it's beneficial that we find all the resources that are available to provide to them. Transportation, that might be a big issue for patients that live on the high desert or don't have a fertility clinic, considering that there's not many. So a lot of these doctors, again, it's linking with them and finding who can provide maybe online or a Skype consultation. And again, a lot of the times it's free. The doctors are more than happy to help, especially during such circumstances, and understanding that there's not a lot of time to look maybe for a ride or to find somebody to take them to these appointments. So they're more than happy to do that same day consultation, Skype, or whatever it is to help the patient. Finances, that's a really difficult difficult barrier to help the patients with, but we're going to discuss further resources that are available to these patients to help them with that. In knowledge, we're basically the ones that provide them with all the basic knowledge, and they can always go to a fertility doctor to seek more details and more knowledge about the topic.
Okay, so now before we move on to the actual resources, I just want to quickly kind of go over the paper I passed out to you guys that says American Society of Clinical Oncology Guidelines. It's two boxes. So this is something that was made by the American Society of Clinical Oncology, and this is their updated practice guidelines from 2013, and it serves as a guideline to provide to providers who are both to providers who care for both children and adult cancer patients, which is something that I'm going to quickly sidetrack on really quick. But you also want to make sure that even if your patient, as a nurse, if your patient is a young child or is a, maybe not child, but like a young adult, you want to make sure that you and the parent and the child, you want to make sure that they know about this option, because as a child, the last thing on their mind is probably, like, I don't want to worry about that right now, I just want my kid to live. But if things go well and their treatment is successful, you want to kind of, maybe that's something that you want the child to make the decision on in the future. So you want to just make sure you talk to both the adults and the younger population. So if you look at the guideline, it kind of encourages for providers, nurses, social workers, other non-physician providers to discuss the risk of infertility with cancer. So if you look at it, it'll talk about some of the interventions that you can do. It'll show you the target audience for the guideline, which is, like I said, the nurses, the doctors, social workers, And then they actually have some key recommendations that you can just kind of go over. So if I want to quickly address some of them, it's you want to refer patients who express an interest in fertility preservation. That's one of the things that they listed. You want to answer some basic questions about whether fertility preservation may have an impact on successful cancer treatment. That might be a huge, deal for the patient, so you want to make sure you're able to address that for them. And then if you just keep looking, it actually gives different recommendations for different patients. So if you're dealing with an adult male, you can present sperm cryopreservation, which is sperm banking, as the only established fertility preservation method for adult females. And again, Karen's going to go over this in more detail later. But for adult females, you can present both embryo and oocyte cryopreservation. And then for children, you want to present information on additional methods that are available for the children but are still investigational. So you just want to make sure you kind of go over these different options that you can go over with your patient. It's a really good guideline. I found it as a really good resource when coming up with this teaching plan with Karen. So if you guys have time, always look into that. And another part that I found was really important is documentation. And as nurses, they, teach us from nursing school, and I'm sure throughout your whole career, documentation. It's so important. And in this case, it's really important because how are you gonna know that the patient was educated on this issue if you didn't document it? So you wanna make sure that you document and see that you want to check that someone did educate this patient on it. Okay, now we can move on to, we can move on to the fertility preservation options. We're good.
Okay, so I'm gonna be discussing the preservation options like Haney briefly discussed. So something you can present to a female patient would be egg freezing. So they have the option to undergo egg freezing. Egg freezing does require a little bit more from the patient financially and emotionally, more than a male patient, because they do have to undergo hormone treatment, and these hormones are usually injections combined with oral medication that is taken for a couple weeks, with in between ultrasounds, blood tests. Every day or every other day requires appointments, vaginal ultrasounds. And again, we have to keep in mind that these patients are already going through accepting that they've been recently diagnosed with cancer. So to top it off, we're adding egg freezing and the emotional roller coaster that it involves. So, and then in the end, they don't know how many eggs they're going to have available. It may seem like they start with 10 eggs and they give them all these hormones, but in the end, really they were only able to harvest maybe 2 or 3 eggs, and maybe that's not ideal, or that's not what they had in mind. They were hoping 10. So they're very disappointed, and it's always, again, a fertility specialist would discuss this further with more detail, but then again, it doesn't allow them the time to do it again and again and again, because they have to get started with their cancer treatment. So it's just this one-time chance, and they invest so much that it may be disappointing to them. So sometimes they don't want to undergo that emotional roller coaster. So it's important as nurses to understand and support them, not give false promises or false hope, but just allow them to vent to you. A lot of the time, like we mentioned earlier, it's taboo in their culture, so they have no one to relate to or no one to discuss this with, because they feel less of a woman, because egg freezing may seem like taboo in their cultures. So it's really important that you are there for them and provide holistic care and support, and always be there to hear them. Another option would be sperm freezing. So sperm freezing is an option that is available for male patients. It's not as involved as egg freezing. It does require a couple of blood tests. Maybe at first the fertility doctor will request a semen analysis, which would require the patient to possibly visit the clinic and do a semen analysis, provide a sample. They count where he's at, might make some recommendations, some antioxidants to hopefully get enough amount or enough of a sample to freeze, or multiple samples. For freezing, a lot of these banks do require an STD panel, and they quarantine the sperm basically until this panel comes back that it's cleared. But they're able to bank as much as they could produce, you can say. So they do have to keep in mind that they have to pay the clinic for accepting the sample and preparing it for freezing, and they do have to pay the banks. Well, also with egg freezing, they do have to pay the banks for preserving their sample. Another option for couples might be embryo freezing. So in embryo freezing, it does require the male and the female, obviously. So either or whoever's undergoing cancer treatment do have this option. And to create embryos is basically an IVF cycle. So again, it requires the women to undergo hormonal therapy and an extraction of eggs, freezing them and growing them. And again, they might hope for 10 embryos, but only come up with one that made it to what we call day 5 or day 6 embryo that is freezable and will hopefully live through the thawing process. So it's important to, again, provide the support and listen to these patients, because not always, even though fertility preservation seems like a very ideal option for all these patients, it doesn't always have an ideal outcome. So it's important to always understand them and give all the resources available to them, and not give them false hope. And again, for embryo freezing, they do have to pay the banks directly for preserving their eggs. A lot of times these are not kept actually in banks, they're kept in the fertility clinics, which then they will return to do their embryo transfer after they completed their cancer treatment and they're ready to start their family. Something to keep in mind with embryo freezing is you always want to give them the option that if they're not a married couple, what happens if after the cancer treatment, they do not remain together and they've already created embryos. There's always an option to create half embryos, half eggs, or freeze just sperm and then create embryos. So you always want to present that to them. Of obviously it's financially costs more. So it's totally up to them. But again, our job is just to provide them with all the information so they can make an informed decision, and give them all their options, and refer them to a fertility specialist that could give them all the details necessary, and they make the best decision that they think that accommodates their lifestyle, their circumstances. So we're gonna go over just briefly over the resources. We'll provide you guys with more information and links after the presentation if you guys would like. There's a lot of fertility specialists, and there's many. We can just go ahead and Google them and find different around the area or close to the patient. Livestrong provides these patients with discounted medication or even free medication. All they really need is a certification from their oncologist verifying that they do have cancer or about to go at cancer treatment, and they give them $5,000 to $10,000 worth of medication. So it's very important that you provide that resource to them. Support groups, there's many support groups online where they can support one another. Livestrong has links to many support groups where other women that are undergoing this, they can discuss it with each other. And again, like we discussed before, counselors, always refer them to counselors, because they are the ones that are educated on listening to these patients,
right,
and making them understand all the knowledge and resources we have provided them, and help them make an informed decision if necessary.
Okay, so let's briefly go over the test. So actually, we'll briefly go over the test. So number 1, the question was, cancer treatment can cause infertility. The answer to that is
True.
And I think most of you guys put that from your looks. So number 2, there are no fertility preservation options for men prior to undergoing chemotherapy. That is false. And we talked about, all the different options that we have a couple slides back. So number 3, fertility preservation options should be discussed when the cancer treatment plan is outlined. And the answer to that is
True.
And number 4, most insurance carriers do not cover the cost of fertility preservation.
That's true, and that's what we have Livestrong for, to hopefully provide them with the
A lot of
necessary
times
resources.
finances is the biggest struggle. Number 5, there are no resources available to help with the cost of fertility preservation related to cancer. That
And
is false.
because there's Livestrong and a lot of fertility doctors, like I mentioned previously, are happy to help these patients and will give them discounted treatment, or the banks will give them a discount on their banking too.
Okay, so what are some of the questions or concerns you guys might have?
Yeah, I have a question. So can the medication used for the fertility preservation in women actually worsen the cancer?
So that's a really good question, actually. And it would usually cause the cancer to get worse. However, once they're aware that she or the patient has cancer, they use a medication called letrozole or Clomid to reduce the amount of estrogen that goes up that would usually or normally grow that tumor. But again, it's totally up to the fertility doctor. They have different protocols, and they decide what's best to accommodate that patient based on the cancer they have.
It's definitely something I would recommend the patient discuss with the actual fertility specialist, because they're the experts in that field.
Okay, and how much does the treatment cost?
It can range from $5,000 to $10,000 for females for egg preservation or embryo preservation. For males, sperm freezing is much cheaper. It could be $1,000, $2,000. But again, we have to take in consideration what bank they choose, what doctors they choose. All of them have different prices, and how much coverage they get on their medication, of course.
Okay, and how long does that process take?
Usually, it takes about 3 to 4 weeks for them to actually harvest the eggs and freeze them. So that's important to take into consideration when planning their cancer treatment.
Yes.
Any other questions?
No, I think that's it. Thank you.
Okay, well, we
Thank you,
gave you guys just a survey to fill out. Hopefully you felt that our presentation was helpful.
Yeah. And again, I gave you guys the handout, so you can always refer to that. And if you have any questions, you can always email us.